Here at the Oklahoma City Pharmacy, we understand that the mail order system has changed over time. The most common feedback that pharmacy receives is that the mail is taking longer to arrive. And you know what? It's true. In today's environment, prescriptions are taking longer to prepare and packages are taking longer to arrive in the mail. We want veterans to feel confident about the mail order system and understand how to solve common problems. In this video, our own Oklahoma City pharmacist will explain the mail order system and answer some common questions. What has not changed, prescriptions still require a physician order. VA pharmacy may only fill medications from an active in-date prescription that has remaining refills. If your prescription has no refills, then we must contact your provider. A pharmacist must verify all prescription orders. Pharmacists perform a variety of safety checks on each prescription order to ensure your medication will work as expected. These safety checks ensure the right medication at the right dose at the right time is received. The VA pharmacy does not automatically refill prescriptions. Every prescription received by mail was either reordered by your provider or requested by someone on the veteran's behalf. If you have received a prescription without ordering it, it was most likely entered by your provider or the system was responding to a request made on your behalf. The best way to ensure your prescription arrives on schedule is to visit with a pharmacist after your provider visit. The pharmacist will verify your meds, provide counseling, and schedule medications to arrive when you need them.
What has changed about the mail order pharmacy? The number of veterans enrolled in VA care is increasing. The number of prescriptions being filled is increasing. So basically, greater workload. This increased workload primarily falls on the mail order system to fill medications for patients. How does the mail order pharmacy work? The mail order system, or CMOP, which stands for Consolidated Mail Order Pharmacy, is a highly automated, high-volume, closed-door pharmacy. Veterans can't walk in and get a prescription filled, it's mail only. CMOP prepares about 80% of our veterans' prescriptions. There are only 7 CMOPs in the country. Unfortunately, there is no CMOP in Oklahoma. Your mailed prescriptions are coming from other states in the U.S. The CMOPs that service the Oklahoma City VA Medical Center include Hines, Illinois, and Murfreesboro, Tennessee. The Hines, Illinois CMOP accepts and processes prescriptions from 29 VA facilities, including Oklahoma. That still doesn't explain the increase in time it takes to mail prescriptions in today's environment. CMOPs are very busy. At any time, all CMOPs combined may have 1 to 2 million prescriptions waiting in the queue to be filled. CMOPs fill prescriptions on a first-in, first-out basis. On an average day, each CMOP fills around 100,000 prescriptions. That's a huge amount of workload to process every single day. At this capacity, it currently takes CMOPs an average of 3 to 4 days to prepare and ship a medication. Like any other business, CMOPs periodically experience delays in processing. Your medication may take more time to fill when there are extreme weather events or storms, equipment breakdowns, staffing shortages, drug shortages. While these problems do not happen every day, they may create delays from time to time. CMOP is making every effort to keep up with demand, and they are acutely aware of veteran medication needs. But as they say, you can't control the weather.
So CMOPs are busy. Remember, CMOP fills the medication, but the United States Postal Service, or USPS, delivers it. Neither CMOP or your local VA pharmacy has oversight or control over the U.S. mail. Once your package is with the courier, it is up to them to deliver it. In 2024, the average delivery time for a USPS package was approximately 3.2 days, with 87% arriving before 5 days. The more distant or rural your location is, the more time it may take for the mail to arrive. USPS is subject to the same weather events, equipment downtimes, and staffing shortages that impact delivery times. So what can you expect today? Remember, providers from all over the state enter orders into the VA pharmacy ordering system for filling. On average, it takes 2 to 4 days to verify your prescription order and send it to CMOP. The pharmacy team here in Oklahoma City verifies thousands of orders every day. On average, it takes CMOP 3 to 4 days to fill your medication and set them up for mail. CMOPs fill tens of thousands of packages per day. On average, it takes 3 to 4 days to deliver a package and longer if the package has more distance to cover. USPS delivers millions of packages every day in the US. Also, to be safe, let's factor in a couple of days to account for weather events or other delays. As you can see, the business of mailing medication is getting busier. So to ensure your medications and supplies arrive on time, veterans are now encouraged to order no later than 14 days prior to needing them. Better yet, given there are no penalties to order refills early, we are encouraging all veterans to order chronic stable medications as soon as they receive them. This routine will maximize the allowable time to deliver medications by mail.
So how can you make refilling medications at the VA easier? Our best practice recommendation is to order refills right after picking up medications at the window or receiving medications by mail. There's no penalty to order early, and the computer will trigger your next refill to arrive before running out. Use your mail package as a reminder to reorder. Simple. Ordering early also has the advantage of alerting you when there's no refills remaining on a prescription. This gives ample time to contact your provider and request a new prescription. Remember, receiving medications by mail saves time, gas, and money. It's easy, and the mail system is the preferred method for regular medication refills. So what if something goes wrong?
First, you can come visit the Oklahoma City VA Main Facility Pharmacy. You'll take a number, speak to a pharmacist, and pick up medications at the window. We're here for you. The second option, and probably the easiest way to solve a prescription issue from home, is to contact the pharmacy call center at 405-456-3700, option 2 to speak to somebody. This call center is staffed with VA pharmacy technicians and pharmacists to help with prescription problems. This includes getting a new prescription, tracking a package, or help with refilling a medication. We're happy to serve you. Either way, our goal is to ensure that you have the medications needed to maintain your health and quality of life.
The bottom line is that when we work together, we can improve the health care of all of our veterans. Pharmacy is committed to providing your medications timely. We hope that this video has explained some common questions and helped navigate the mail order system. If you have any questions, please contact one of the pharmacists at the counseling booth, or you can talk to a technician at the window. We appreciate your service. Thank you for your time, and thank you for your attention.